Today we will see about the anatomy of stomach. So stomach, it is the widest and most distensible part of the alimentary canal between the esophagus and the duodenum. There are some main functions. So the first one, it forms the reservoir for food and it mixes that food with the gastric secretion and together it is called as chyme. This chyme, this is controlled by its delivery is controlled by the stomach into the small intestine, and the hydrochloric acid secreted by the gastric glands destroys the bacteria that is present in the food. And the last function is Castle's IF means intrinsic factor present in the gastric juice helps in absorption of vitamin B12 in the small intestine. Now let's see the location of the stomach. It is present in the upper left part of the abdomen, occupying the left hypochondriac, epigastric and umbilical region. Its shape is mostly J-shaped. Let's see the size and capacity of the stomach. The length is 10 inches. Capacity differs at birth, which is 30 ml, at puberty, which is 1000 ml, in adult during adulthood, that is 1500 to 2000 ml. Next we will see the external features. It is divided into ends, curvatures and surfaces. There are two ends, cardiac and pyloric, curvatures greater and lesser, surfaces anterior and posterior. Okay. First we will see about the cardiac end. It joins the lower end of esophagus and it has cardiac orifice, while pyloric end joins the proximal end of the duodenum and pyloric orifice is present there. So in curvatures, the greater curvature, it is convex and lesser is concave. The greater curvature is present along the long left border and the cardiac notch is present there, while for lesser curvature it is present along the short right border and the angular notch or incisuro-angularis is present there. So the attachments for greater curvature are greater omentum, gastrosplenic and gastrophrenic ligaments, while for lesser curvature it is lesser omentum. The stomach has four parts: cardiac, fundus, body and pyloric. The cardiac part, it is the part that is present around the cardiac orifice, and the fundus part, it is the dome shaped part of the stomach above the horizontal plane drawn at the level of cardiac notch. Then superiorly it reaches the left fifth intercostal space below the nipple. So if there is any gastritic pain, it will mimic the angina pain. Then the body of the stomach is the major part between the fundus and pyloric antrum. The final part is the pyloric. It is divided into pyloric antrum, pyloric canal and pylorus. The pyloric antrum is the proximal wider part and pyloric canal is a narrow and tubular part. Pylorus is the distal part. Next we will see the relations of the stomach. There are two relations, peritoneal and visceral. Peritoneal relations. Here the stomach is covered by peritoneum except where the blood vessels run along its curvature and a small area called the bare area of the stomach, which is directly related to the left crest of diaphragm. Next is visceral relations. Relations to anterior surface. The right side is related to the left lobe of liver, quadrate lobe of liver near the pylorus, and the left side is related to diaphragm and rib cage. The lower part is related to the anterior abdominal wall. So the relations to the posterior surface, we are calling the structures present in the relations as stomach bed. So to remember the mnemonic 3 left SPD. The 3 left indicates left kidney, left suprarenal gland and left colic flexure. Then S for spleen and splenic artery, P for pancreas, diaphragm for D, then transverse mesocolon. Microscopically, the stomach has serous coat and muscular coat. The serous coat, it is related to the peritoneum, and muscular coat has 3 layers: outer, middle, inner. Outer for longitudinal, middle for circular, inner for oblique. Then the interior of the stomach has gastric folds or rugae, then gastric pits and gastric canal. Next is arterial supply. Gastric artery, gastroepiploic artery and short gastric artery. The gastric artery is derived from, that is, the left branch is derived from celiac trunk, then right from common hepatic artery, then left gastroepiploic artery is a branch of splenic artery, and right gastroepiploic artery is a branch of gastroduodenal artery. Short gastric artery is a branch of splenic artery. Then the venous drainage. The veins correspond to the arteries and drain directly or indirectly into the portal vein. So for lymphatic drainage, there are 4 areas. Area 1, it is the left gastric lymph nodes. It drain into the left gastric lymph nodes. Area 2 drained into right gastroepiploic and pyloric. Area 3 pancreatosplenic. Area 4, right gastric and hepatic nodes. All these finally drain into the celiac nodes. This is the diagram of the stomach bed. Finally, we will see the nerve supply. It is divided into sympathetic and parasympathetic. Sympathetic is from T6 to T10 spinal segments through greatest plankic nerves, then celiac and hepatic plexus. Parasympathetic fibers are directly derived from the vagus nerves. Then at the gastroesophageal junction, the left vagus nerve becomes the anterior vagal trunk and right vagus nerve becomes the posterior vagal trunk. The anterior vagal trunk has hepatic branch, celiac branch and anterior nerve of lateral jet, while posterior vagal trunk has celiac branch, nerve of Grassi and posterior nerve of lateral jet.